Module Overview. As healthcare organizations increasingly outsource essential services such as billing, IT support, cloud hosting, analytics, telehealth platforms, and document storage to third-party vendors, it becomes critical to extend HIPAA compliance obligations to these entities. This module explores the role, responsibilities, and legal accountability of business associates, BAs, and introduces the Business Associate Agreement, BAA, a mandatory, legally binding document that establishes the terms for HIPAA compliance between covered entities and their third-party partners. Through an in-depth exploration of legal frameworks, compliance architecture, enforcement scenarios, and practical strategies, this module equips you to understand and identify business associates and their activities, draft and enforce legally sound BAAs, monitor vendor compliance, mitigate third-party risk exposure, align internal and external security practices with regulatory standards. Module Content 1. Who is a business associate BA? A business associate BA is any person or organization not part of a covered entity's workforce that creates, receives, maintains, or transmits PHI on behalf of a covered entity or provides services involving PHI. Examples of business associates include cloud storage providers, e.g. AWS, Microsoft Azure, medical billing companies, claims processors, EHR and IT system vendors, document shredding or archiving services, legal or accounting firms with access to PHI telehealth and mobile health application providers, even subcontractors of BAs, called business associate subcontractors, BASs, are bound by HIPAA and must sign downstream BAAs. 2. What is a business associate agreement? BAA. A business associate agreement, BAA, is a legally required contract between a covered entity and a business associate, or between a BA and their subcontractor. It ensures the BA will comply with HIPAA privacy, security, and breach notification rules, will implement appropriate safeguards to protect PHI, will report breaches or security incidents promptly, will ensure their subcontractors also follow HIPAA standards, may be subject to audits and investigations, may face liability for violations of HIPAA. Without a BAA, a covered entity can be held liable for any violations by their third-party vendor, even if the covered entity didn't commit the violation directly. 3. Mandatory elements of a BAA per 45 CFR paragraph 164.524e. A compliant BAA must include a detailed description of permitted and required uses of PHI, an agreement to not use or further disclose PHI outside the permitted scope, a clause stating the BA will use appropriate safeguards, technical, administrative, and physical, an obligation to report any breach or security incident, a requirement to ensure subcontractors also comply, a mechanism to terminate the agreement if a material breach occurs, provisions for the return or destruction of PHI upon contract conclusion. Failure to include these can result in non-compliance penalties for both parties. 4. BAA and HIPAA Security Rule. The HIPAA Security Rule mandates that BAs, like covered entities, must conduct a risk analysis, implement security policies and procedures, use access controls, encryption, and audit logs train workforce on data security, maintain incident response and breach reporting protocols. Business associates cannot claim ignorance as a defense. They are directly liable under HIPAA, particularly since the enactment of the HITECH Act 2009. 5. Third-party risk management and monitoring. To maintain compliance and ensure data protection beyond the BAA signature, organizations must establish vendor vetting protocols. Before contracting, evaluate the BA's HIPAA compliance history, data protection infrastructure, certifications, etc. Ongoing monitoring, use audits, periodic risk assessments, and compliance check-ins to ensure continuing adherence. Breach notification, flowcharts, ensure roles, Timelines and reporting processes are clearly defined and rehearsed. Termination protocols. On contract termination, ensure PHI is either returned securely or destroyed in compliance with HIPAA. Tip: use vendor management tools and risk scorecards to track compliance across your vendor ecosystem. 6. Real-world enforcement and breaches involving BAs. OCR has penalized covered entities and BAs for BAA violations. Filefax Inc. 2018, improper disposal of patient records, penalty $100,000 Anchorage Community Mental Health Services, inadequate security measures, penalty $150,000 Catholic Healthcare Services, BA of 6 nursing homes fined $650,000 for mobile device breach North Memorial Healthcare, fined $1.55 million for failing to execute a BAA with a major vendor. These cases highlight the importance of documented, enforceable, and monitored BAA relationships. 7. Cross-compliance with global and industry standards. Standard BAA relevant alignment. ISO 27001, 277001, third-party vendor risk controls, contract security provisions. NIST 800, 171, 866, vendor management under security control families. SOC2, Type 2 reports, vendor trust and assurance practices. EU, GDPR data, processor agreements, vendor accountability, high-tech, Act BA liability for HIPAA compliance and breach notifications, accreditation bodies and continuing education programs in health IT, healthcare law, and privacy engineering recognize BAA mastery as part of organizational compliance maturity. 8. Best practices for covered entities. Maintain a BAA inventory log, include expiration dates, contact points, compliance attestations, standardize BAA templates vetted by legal counsel, train internal stakeholders on vendor evaluation criteria, avoid set it and forget it. BAA compliance is dynamic and evolving. Conduct annual reviews of BAA arrangements.